If you've been applying to remote nursing jobs and getting nowhere, today's video may completely change your strategy. Because here's the truth. Most nurses are applying for remote jobs the same way they apply for bedside jobs. And that's exactly why they are getting rejected. Today, we're going to talk about how nurses actually break into remote roles, what employers are looking for, and the biggest mistakes that keep qualified nurses from getting interviews. Let's start with a myth. A lot of nurses believe remote nursing jobs are simply bedside jobs performed from home. They are not. Remote employers aren't hiring nurses because they can start IVs. They're hiring nurses because they can solve problems independently. That distinction matters. Think about it. When you're working remotely, there's no charge nurse standing beside you, no manager walking through the unit, no team sitting at the nurse's station. You're expected to manage your workload, communicate effectively, navigate technology, and make sound decisions with minimal supervision. That's what employers are buying. Not your stethoscope skills, your judgment, your organization, your communication, your ability to work autonomously. And once you understand that, your job search strategy changes completely. Let's talk about the remote nursing jobs that are most accessible today. The first category is case management. Case managers coordinate care, assist with discharge planning, review treatment plans, communicate with providers, and help ensure patients receive appropriate services. Why nurses transition successfully into case management? Because you've already been coordinating care. You've already been communicating with providers. You've already been advocating for patients. The second major category is utilization review. These nurses review medical records and determine whether care meets established guidelines and payer requirements. Now, some nurses hear that and immediately think, that sounds boring. But utilization review often offers predictable schedules, remote work flexibility, and competitive compensation. The third category is clinical documentation improvement, often called CDI. These professionals review documentation, identify gaps, and work with providers to ensure accurate clinical representation. Strong documentation skills become extremely valuable here. The fourth category is nurse advice lines. These nurses provide patient guidance by phone, assess symptoms, recommend next steps, and help patients navigate healthcare decisions. The fifth category is clinical research. Remote research nurses assist with study coordination, data collection, patient communication, and compliance activities. And finally, there are emerging opportunities in healthcare technology, population health, quality improvement, insurance, healthcare consulting, and even healthcare recruiting. The opportunities exist. The challenge is positioning yourself correctly. Let's talk about why most nurses struggle. Mistake number one, they only apply. They don't prepare. I see nurses submit 50 applications and then wonder why they haven't received interviews. Meanwhile, their resume still reads like a bedside nurse applying for another bedside role. Remote employers need to see transferable skills. For example, Instead of saying provided patient care, show coordinated interdisciplinary care plans across multiple disciplines. Instead of saying completed patient documentation, show maintain detailed documentation while managing competing priorities in a fast-paced environment. Do you see the shift? We're emphasizing skills that matter remotely: communication, organization, documentation, critical thinking, independence. Those are remote job currencies. Mistake number 2, ignoring technology. Many nurses underestimate how important technology skills have become. Today's remote nurse may work with electronic medical records, Microsoft Teams, Zoom, Salesforce, Epic, Cerner, case management platforms, insurance systems, data reporting tools, workflow management software. If you're uncomfortable with technology, employers notice. You don't need to be an IT expert, but you do need to demonstrate adaptability. Take online courses, earn certifications, learn new systems. Show employers that you're comfortable in digital environments. Mistake number 3, applying for every remote job. This is where many nurses waste months. Not all remote jobs are equal. Not all remote jobs align with your background. A labor and delivery nurse applying for utilization review may have a harder path than a nurse applying for maternal health case management. An ICU nurse may be highly attractive to complex case management teams. An oncology nurse may have unique opportunities in specialty care coordination. Look for alignment. Build a strategy around your strengths. Now, let's discuss something nobody talks about enough: pay. Many nurses fear remote work because they assume it automatically means a pay cut. Sometimes that's true. Sometimes it isn't. What matters is total compensation. Let's compare. Imagine a nurse earning $95,000 annually at the bedside. They're working weekends, holidays, night shifts. They're commuting, paying for gas, paying for parking, paying for meals away from home. They're experiencing burnout. Now, imagine a remote role paying $88,000 per year. At first glance, it looks like less money. But when you account for reduced commuting costs, improved schedule flexibility, fewer childcare challenges, and quality of life improvements, the equation changes. Career decisions should never be based solely on salary. Evaluate the entire package. Now, let's talk about networking, because this may be the most overlooked strategy in the remote nursing job search. Most nurses apply through job boards. Successful candidates often connect with people already doing the work. Find nurses working remotely today. Ask questions. Learn about their transition. Understand what skills helped them break in. Join professional groups like the RN Network on LinkedIn. Attend webinars. Participate in online communities. The healthcare industry is surprisingly small. Relationships matter. And here's another important point. Remote jobs are competitive, very competitive, in fact. A bedside opening might receive 50 applicants. A remote opening may receive 500. That's why your resume, LinkedIn profile, and interview preparation need to be stronger than average. You cannot rely on volume. You must rely on strategy. Let's finish with what recruiters actually want to hear. When interviewing for remote roles, avoid saying, "I just want to work from home." That's not a compelling business reason. Instead, say, "I've discovered that my strengths align well with independent work environments, care coordination, documentation, communication, and problem solving. I'm interested in leveraging my clinical background in a role that allows me to create impact through those strengths." Do you hear the difference? One focuses on convenience, the other focuses on value. Employers hire value, not convenience. Here's your action plan. If you're serious about remote nursing, step 1, identify which remote specialty aligns best with your experience. Step 2, rewrite your resume to emphasize transferable skills. Step 3, update your LinkedIn profile. Step 4, build relationships with nurses already working remotely. Step 5, apply strategically, not randomly. Because remote nursing isn't disappearing. In fact, healthcare organizations continue expanding virtual care, care coordination, population health, and digital health programs every year. The opportunity is real, but the nurses who land these jobs understand one thing. Remote employers aren't hiring bedside nurses. They're hiring independent problem solvers who happen to be nurses. If this video helped you, subscribe to the RN Network and tell me in the comments, if you could work remotely tomorrow, what type of nursing role would you choose? I'm Christina, and I'll see you in the next video.